Today I'm going to share my experiences, challenges, whatever I've been through. And that saved me from surgery. Now I'm trying to save other people from undergoing that. 22 years ago, like every teen, I loved my sports, I loved my activities, and had a dream of becoming a spine surgeon. I was fairly good at competitive sports, cricket, handball, and athletics. Shot put to be precise. At that point in time, I felt my life was on a set course and my life's plan was on. During competitions and training, I used to get back pain. And the very common diagnosis was given is a pulled muscle or a muscle strain. The common treatment generally given is rest, medication, warm water fermentation, and generalized exercises which used to control my pain. Now, with the passage of time, these pains became intense, sharper, and it took longer to relieve. One fine day, I had a sharp pain running from my back to my feet. And this is known as sciatica. With that pain, simple activities like turning in bed, sitting to standing from a soft surface or from bed was difficult and challenging. That is where I got my first diagnosis, big one, known as slip disc L4, L5, L5S1. The pain which used to take hours to relieve now was taking days. Days turned into weeks, and weeks went slowly like months. Simple activities were becoming challenging. Sports and intense activities were out of question. If I attempt, pain was back. Now this is in this section you will see the two brown rectangles are bones. The black one between the two brown rectangle is called disc. Usually it has to be in line, which we can see. In the next image you can see it has slipped out of its position and it has pressed on spinal cord and the nerve. Now this is called as slip disc. Now when that happens, as I mentioned, you get a sharp pain running from your back towards your feet. At this very point in time, simple things, simple activities were becoming a challenge. Pain takes longer to relieve, very sharp, very intense. A point came where my rest was common, my activities were ceased, sports was out of question. At times, the pain was so intense that the thought of getting an invasive procedure done was crystallizing, but didn't materialize. I was so desperate that I was trying different treatments, starting from massages, acupressure, TENS, IFT. Moist packs were my best friend. They used to relieve my pain, traction, etc. I used to get relief, but the moment I go back to sports or anything, pain used to come back. Intense pain used to bring a thought of getting an invasive procedure done. Now the big question with invasive procedure is, the big question I had that time was, what will be my quality of life? Will I be able to go back to my activities and sports, or I have to give it for the life? Most important thing, it didn't resonate with the person who I was. Now during this journey, which I didn't realize at that time, when I recovered, I came out of it, that is where I realized I had three major blessings in this. First, in any slip disc case where the spinal cord and nerve is compressed, there is a most important factor we need to check is called neurological stability. Meaning, you are able to move your foot and toes and you are able to pass your urine and motion. If this stability is compromised, answer is an invasive procedure. Then there is no turning back. My first blessing was I was neurologically stable. My second blessing was, with the help of my two professors, expert in osteopathic medicine and sports medicine, they addressed the issue at its roots level. And I could heal out of this condition and come back to my life. My third blessing was where my desperation got transformed into perseverance. Starting from getting healed to help patients getting back to their lives. Now, 22 years ago, when I got my treatment with osteopathy and sports medicine done. Today, I'm doing my cycling, running, trekking, long distance biking, and my training protocols, which I follow for my fitness routines. Now, when I came out of this situation, after some time I realized some of the, which you can say led me to my eureka moment. That there is a huge difference between invasive procedure, or you could say there is a huge gap between invasive procedure and conservative treatment. There's a huge gap. Second, we have fantastic skilled surgeons who can operate it. There's no second thought and doubt on the surgical skills we have. My experience taught me that where there are very few people who can treat it conservatively and treating the root of the problem, which I'll talk about in further ahead. Now that is where I got my purpose, motivation, determination, perseverance to study osteopathy, sports medicine. On the way, I discovered chiropractic and orthopedic manual therapy. And today I'm helping people and patients who are suffering with this debilitating disease to go back to their lives, to do their activities, to spend time with their loved ones, and most important thing, to do what gives them meaning to their life. Now, during this journey of going through these pains, learning the science, working, I realized few of the learnings which I learned, which I'll share with you. There is a huge difference between need and want of an invasive procedure and a conservative approach. The need and want from patient perspective, the need is when you should be able to do your day-to-day activities like turning in bed, sitting, standing. Simple things which you have to do, which we do in day-to-day life. Want is the desires that we want to do. Someone wants to play sports, someone wants to do activities, someone wants to spend time with their loved ones, socialize, dance, go for movies. The most important learning which I got is first address the need. Get your day-to-day activities back to life and then think about going into sports or intense activities. This is where it makes a huge difference. Second, there's a huge difference between pain relief and treating the root of the problem. When I had my pains, initially I didn't realize this, but when I had my pains, the moment my pain used to go down with the various treatments, I used to start my activities and sports back. And it was not surprising that sharp pains came back. Now that is where, over a period of time, when it got multiple times repeated, it helped me understand, or I experienced the difference between something called as pain relief versus treating the root of the problem. General perception, what we have is, I don't have pain, and I can go back to sports. Okay, so the treating pain and treating the root of the problem are two different things. Third point, the body itself has got tremendous healing potential. The nature has given it. Our job lies at providing only two things: right tools and right environment for the body to just heal, and it happens. I have experienced it with me and my patients, which I see daily. Fourth, the power of hope and faith. Faith, you can say faith in God, faith in doctor, faith in treatment, faith in yourself. When I went through my tough times, I can't put it in words what faith and hope can give courage to go through those times. I have seen times where one of the most devastating time which I had was I could not walk to washroom. I had to crawl, and that just broke me apart. My life was like at a shattering point. So I personally believe, and I practice, don't touch anyone's hope and faith, and most important, don't let yours also get touched. Fifth point, in life, everyone derives its meaning from different things. It could be playing sports, it could be doing intense activity, it could be traveling, it could be spending time with your loved ones. Without that, if you are not able to do, life is going to become a dead weight one day. Sixth point, every one of us have different commitments in life. We want different things from life. Now, sports person cannot be treated like a surgeon, and a middle-aged cannot be treated like a senior citizen, or a senior citizen cannot be treated like a middle-aged person. The whole point is to customize the protocol against the need of the person or for that individual's life, rather than generalizing the protocols. Now this was me who has experienced, you can say, healing. This was me in somewhere around 2010-12, and this is me today. Playing sports, enjoying my life, enjoying my activity, spending time with the loved ones. I do what gives, without thinking, what gives meaning to my life. Now this healing, what I have got, we are helping other people to achieve it. Now, this is the few case studies of my patients. You can see at L4, L5 level, the disc has come out and gone down. This is called L4, L5 paracentral disc caudal migration. The spinal cord was pressed, nerve was compressed, but patient was neurologically stable. We could go with conservative approaches. Post-intervention, post-treatment, you can see it has gone back and it's in its place now. Now this person has got long list of activities to do it before the person retires. We have successfully finished 2, rest we are preparing for. Now this is degenerative spondylitis. You can see the gap between the bones are not there. Again, the person was found to be neurologically stable. We attempted, and you can see the gaps between the bones have come back. Now this person is a surgeon, a super specialty surgeon, who now operates and saves other patients, and he is transmitting his knowledge to the young generations of surgeons. This is one more case study where we can see L4, L5, the disc has come out, and you see the down black spot that is called L5S1 disc extrusion. This is grade 3, extremely painful, extremely dangerous. Again, patient was neurologically stable, we attempted, and you can see both are in much better shape. Again, this person is a surgeon, now is operating on patients, helping them to go back to their lives. I admire and personally, my role model when it comes to fitness and training. Thank you, and have a nice evening.